Hello, and welcome to our Spirit of Women program, Heart Strong. Tonight we've invited our Genesis Heart and Vascular team to share the steps that we can take to keep our hearts strong. And later, our cardiac rehab specialist will demonstrate exercises you can do at home to strengthen your heart. Be sure to add your name in the comments to let us know you're watching. And when the live program ends, we will draw names to win a door prize from our Spirit of Women business partners. We'll announce the winners in a separate post following tonight's program, and we'll contact the winners via Facebook Messenger. Tonight, we're giving away gifts from the Community Bank, Airbond International, and Northside Pharmacies. Now I would like to introduce you to Tabitha McKenzie, Director of Genesis Heart and Vascular Services. Welcome, Tabitha.
Thanks, Linda. I'm happy to be here this evening. We've invited two of our fellowship-trained cardiologists, Dr. Peter Unkovic and Dr. Mohamed Ahmed from Genesis Heart and Vascular Group, to present ways to keep your heart strong and how Genesis Heart and Vascular Institute is helping. Although some heart disease risk factors like family history can't be controlled, there are several simple lifestyle changes that can be made to improve your heart health. Here to tell us more is Dr. Peter Unkovic. Dr. Unkovic joined the Heart and Vascular Group in the fall of 2020, specializing in cardiology. He completed his fellowship in cardiovascular disease at Doctors Hospital in Columbus, and a fellowship in advanced heart failure and transplant cardiology at The Ohio State University. Welcome, Dr. Unkovic.
Thank you, Tabitha. I really appreciate the opportunity to be here tonight to speak with everybody. There's lots of risk factors out there for heart disease, and I think it's very important that we're all aware of the various risk factors in our lives. There are some things which we don't have control over, like your age and the genes that you've inherited from your family. However, there are certain things that we do have control over. And roughly 1 in 3 Americans has at least one of the following: either high blood pressure, high cholesterol, or active tobacco use, which are all significant risk factors for heart disease.
Can you share steps to help us keep our heart strong?
The combination of what foods you're eating. At the end of the day, the fuel you put into your body is very important, and it helps to determine how well the heart's going to function. Additionally, things like obesity put a significant strain on the heart, and that's why we highly encourage folks to maintain a healthy weight and lifestyle so that we're not putting undue strain on people's hearts. Diabetes is a common problem in our society, and it's something that is known to have terrible effects from head to toe, and especially in the heart. It can lead to increased risk for heart attacks and strokes and development of congestive heart failure.
Thank you, Dr. Unkovic. Can you tell us about a heart-healthy diet and how sodium affects our heart?
So when we think about a heart-healthy diet, one of the most important things that we talk about is sodium. And most commonly people know sodium as table salt, but it goes way beyond the salt sugar that you have on your table. Sodium is an important element that's used in a lot of our preserved foods, which helps keep them from spoiling. So we see there's high sodium contents in things like canned fruits and vegetables, prepared meals. A lot of the things that restaurants do to make the food delicious is adding lots of butter and salt, which is great for when you have your meal out, but in the long term can have some detrimental effects. And specifically in the world of congestive heart failure, which is my specialty, but is for heart health overall, high sodium leads to increased fluid retention, and it can lead to higher rates of high blood pressure, and these can all down the line lead to increased rates of congestive heart failure, stroke, and heart attacks. In addition to the sodium, which we just spoke about, there's lots of other parts to a healthy diet that we like to focus on, and these include eating things like fresh fruits and vegetables on a daily basis. And if fresh fruits and vegetables aren't available, fresh frozen are a great alternative option. They have lots of the same nutrients, but don't tend to have as much sodium and other harmful additives. Additionally, we like to have diets rich in whole grains, lean, healthy proteins such as meats and fish, and low-fat cheeses and dairy is another healthy option for our diets, and making sure you're drinking adequate water intake every day. As we talk about a heart-healthy diet, it's important that we have balance between eating the fresh fruits and vegetables, the lean proteins, the healthy whole grains, and of course things like sweets and fats are going to come into the diet, and that's okay, but we want to use those as exception foods. Those are more of a special treat than an everyday kind of item.
We all know medication is important. Does exercise also help with risk factors?
Absolutely. Exercise is a vitally important part of keeping your heart strong. In many ways, you should almost view exercise like an additional medicine you take, like you would take something for your blood pressure or your cholesterol. Exercise has great effects on helping all of those things. So we recommend to stay active. About 30 minutes a day is our recommendation. And this can come in all different forms, and something like even just walking around your neighborhood is a great way to get some exercise that doesn't cost anything. It's low impact on your joints, but can have a lot of wonderful effects. Increased exercise has been proven to lower your blood pressure. It's been proven to lower your bad cholesterol and raise your good cholesterol levels, as well as to lower your resting heart rate and improve your overall physical fitness and well-being.
Can you touch on how sleep and stress factors can help reduce our risk factor for heart disease?
Absolutely, we can definitely discuss those. Sleep is a vitally important part of the day. A lot of times we tend to forget it because we don't always remember the part of our night that we're sleeping, but your sleep is the time when your body rests and recovers from everything you've put on throughout the day. And we recommend to get between 6 and 8 hours of sleep a night is the recommendations. And this has been proven to also help lower your blood pressure, lower your stress levels, and lower your risks of heart attacks and strokes. And additionally, if you are someone that doesn't tend to sleep well throughout the night, this is something you should talk to your doctor about. Because a common condition that we face in our population is untreated sleep apnea. And this is something that's very important to diagnose because if you have it, it can lead to a higher rates of high blood pressure, heart rhythm abnormalities, stroke, and heart attack. Inadequate sleep in all of its forms can put us at an increased risk for heart disease. So please make sure you're getting a good, healthy night of sleep every night.
Tell us what else we need to know about keeping our hearts healthy.
Relaxation is very important for your body. When we're under chronic high levels of stress, which is very common in our everyday lives, this can lead to increased risks of high blood pressure and other abnormal effects on the heart. It's important to find healthy ways every day to relax and unwind. Decreasing your stress levels can have significant beneficial effects for your heart. And additionally, as you do relax and unwind, make sure you're finding healthy ways to do it, because high stress levels can also lead to increased rates of depression, anxiety, and other medical conditions.
We often hear about know your numbers. Can you elaborate on what this means?
Absolutely. It's really important that you understand your numbers so that you can be a partner in your healthcare along with your doctor. So there's 3 important ones I'm going to touch on today that I think are vitally important for you to know and understand in relation to your health. The first one is your cholesterol. So there's a couple numbers within your cholesterol that you want to know. Number 1 is your LDL, which is your quote-unquote bad cholesterol. Number 2 is your HDL, which is your quote-unquote good cholesterol. And number 3 are your triglycerides. In addition to your cholesterol numbers, you should also know your blood pressure and your blood sugar. So to go back to the cholesterol, when we talk about cholesterol, we want to know what our total cholesterol number is. On average, we recommend a total cholesterol number of less than 200 is advisable. That is considered a healthy level, and that's the combination of the LDL, the HDL, and your triglycerides. When we break that down further, the things that we want to look at is for your LDL, the bad cholesterol, we like to have that level be less than 100. And if you're someone in the past that's had other conditions such as a heart attack, a stroke, or diabetes, we want that number to be even lower, sometimes as low as 70 or under 50. For your HDL, the good cholesterol, that's the number we actually like to be higher. So we tend to recommend a healthy level is a level greater than 50. So with your good cholesterol, the ways that we work to boost this are not through medications. We do this through things like physical activity has been proven to raise your good cholesterol numbers. Healthy lifestyle has been shown to have higher levels of good cholesterol. So this is more of an overall look at your total health, more so than anything that we can treat with a medication. Triglycerides are the third component of your cholesterol panel. And traditionally, we like this number to be less than 150. And a lot of times, this is directly related to your blood sugar. So this can either be, some people have isolated problems with their triglycerides, which is something that you can discuss with your doctor about. And sometimes this is also related to, especially commonly in patients that are diabetics, If you don't have a well-controlled blood sugar, it can lead to you having high elevated triglyceride levels. When viewing your blood pressure, you want to look at both numbers. It's important to make sure that both the top number, the systolic blood pressure, as well as the bottom number, the diastolic blood pressure, are both under the recommended levels of 130 and 80 respectively. And if you have questions, please discuss this with your doctor, and when you go to see them for visits, they may adjust your medications to be making sure you're staying under these recommended levels. We have recently found that having tighter blood pressure control has shown to reduce risk of events such as heart attack, stroke, and other cardiovascular disease. We've learned more in recent years that making sure we're monitoring our blood sugar is just as important to cardiologists as it is for your general physician. That there's significant overlap between heart disease and diabetes. And so it's important that we want to make sure we maintain a fasting blood sugar, which means you haven't had anything to eat or drink for about 8 hours. We want to have a level under about 100. That's the recommended normal. And high blood sugars and uncontrolled diabetes can both be proven and shown to have abnormal effects on the heart and increasing your risks for things such as heart attacks, strokes, and development of congestive heart failure. So we've covered a lot of information today, and I don't want this to seem overwhelming. You know, it's important we mention these things, so these are things that you can discuss as you talk with your family doctor about, all these different conditions. Healthcare is a journey, and it's really important that you're an active participant in it. Our goal is to work in a close partnership with you moving forward to make you the healthiest, best version of you that you can be.
Thank you, Dr. Unkovic. That was great information. February is National Heart Month, so there's no better time to take action to help our hearts. The Genesis Heart Vascular Institute is proud to support our community with an outstanding team of highly skilled staff, board-certified physician specialists, nationally accredited care, and the latest in life-saving technology. We are located in Zanesville with offices in Cambridge, Somerset, and Coshocton. Now let's hear from Dr. Mohamed Ahmed. Dr. Ahmed is an interventional cardiologist, board certified in nuclear medicine, internal medicine, cardiovascular disease, and interventional cardiology. He has completed fellowships at Henry Ford Hospital and University of Massachusetts Medical School. Welcome, Dr. Ahmed.
Thank you. So since we met last 2 years ago, I would like to share with you what we have developed here in Genesis Heart and Vascular Institute over the past 2 years or so. We're excited that we added a lot of procedures that can help to keep your heart strong. Most of the procedure are typically done through a minimally invasive approach instead of open heart surgery. We have mitral clip procedure to treat leaking on the mitral valve, TAVR procedure to treat narrowing of the aortic valve. We also added Watchman procedure in patients with atrial fibrillation who cannot be on anticoagulation. So we will be talking about that. So the structural heart team is a very large team. Any procedure that I described, TAVR, Watchman, or mitral clip, requires a lot of manpower. We have nurses, structural heart nurses. We have nurse practitioners. We have anesthesia team, cardiothoracic surgeons, interventional cardiology team, general cardiology, imaging. There's a lot of people involved in your care. Although you meet myself or nurse Brittany, there is a lot of people behind the scene working to make this happen. And we are so proud of this team.
I have a few questions that we frequently get asked. Dr. Ahmed, you've told us a lot about TAVR. Can you tell us who's a candidate for this procedure?
So I'll start with TAVR. First is a transcatheter aortic valve replacement. Basically, you have patients with aortic stenosis, meaning that narrowing of the aortic valve. This condition, if it's not treated, it can lead to heart failure, failure of the heart pump. It can lead to death. So it's very important that it needs to be treated. It's a mechanical problem. You cannot fix it with medications. If you have severe aortic stenosis or narrowing of the aortic valve, that needs to be fixed with a valve. The standard of care for years and years has been open heart surgery. Over the past 10 years or so, there have been great advances in the field of interventional cardiology. So we have been able to put a new valve in through the groin. It's not an open heart surgery, it's just a procedure. It requires an overnight stay in the hospital. We do it through a very small needle stick in the groin. We typically do it while patients are awake, and as mentioned before, more than 95% of our patients go home the next day.
Can you tell us more details about how long this procedure takes and what happens after the procedure?
So typically the TAVR procedure takes around 45 minutes to 1 hour, give or take. Most of the time will be preparing the patients to go for the procedure room and the care after that. The actual procedure will take around 45 minutes. Of course, there is a lot of planning before the procedure, including CAT scan of the body, including echocardiogram and other multiple non-invasive testing. Typically, the actual procedure, 45 minutes to 1 hour. After that, we admit our patients to either the floor or the ICU. We watch them overnight for any complication that can happen. The complication rates in general, major complications are really low. I would say less than 2% most of the cases. Like I mentioned before, more than 95% of our patients will go home the next day.
After an implant, will patients continue to take blood thinners and aspirin?
A lot of approaches, the current recommendation is definitely baby aspirin, 81 milligrams, that you take it for life after the valve implantation. And that's about what we need, and that's it. You don't need any other blood thinners.
Can you tell us more about Watchman and what to expect after this procedure?
Watchman is an exciting, procedure that we added recently to our toolbox. Watchman procedure is typically done for patients who have atrial fibrillation. Atrial fibrillation is an abnormal rhythm. Just let me give you a little idea about atrial fibrillation. Patients with atrial fibrillation, they will be at risk to develop stroke based on scoring system. And that's why, as physicians, we put our patients on blood thinners. The reason that we put them on blood thinners is because there is a certain area in the heart called the left atrial appendage. If you are in atrial fibrillation, you can develop clots in that area, and the clots can go up and cause stroke. If we have you on blood thinners, the chances of you developing clots in your heart extremely low. Now, there are some patients that cannot be on blood thinners for whatever reason. Most common reason is bleeding. The other reason is fall risk. So what we have is a Watchman procedure. Watchman is a device that we implant in the left atrial appendage to close it off, so it does not develop any clots, and it is a good alternative to blood thinners. So the candidates for Watchman procedure: anyone who has atrial fibrillation and cannot be on blood thinners for whatever reason, for bleeding, for low blood counts or anemia, for frequent falls. I would say discuss with your primary care physician and ask if you are a candidate for Watchman. And if your primary care physician or cardiologist think you are a decent candidate for Watchman, then they will make the referral to myself or my colleague, Dr. Body, from electrophysiology, and we will take it from there.
What are the typical results after a Watchman implant?
Once again, it's the procedure, the Watchman procedure itself, it's not a complicated procedure. There is preparation for that. In this institution, what we do is we do a CAT scan to see if you're a good candidate. More than 95% of our patients will be candidates to have the Watchman device in. From procedural standpoint, once we bring the patient in, we do the procedure, the Watchman procedure. We keep our patient overnight, and 95% or more, the procedure is successful. We keep our patients on blood thinners, which is, it could be warfarin or it could be Xarelto, any anticoagulant agent, blood thinners, in addition to aspirin for total duration of 6 weeks. And the reason for the blood thinners and the aspirin following the device implantation is just to make sure that the device become part of your body. And we do a CT scan or a echocardiogram 6 weeks later, and if everything is good, then we stop the blood thinners forever.
Dr. Ahmed, can you share with us more about MitraClip and who are the candidates for this procedure?
MitraClip is another procedure that's an alternative to open heart surgery for a patient who we think they are not good candidates to go for open heart surgery because of age or because of multiple comorbid conditions. MitraClip is done for patients with mitral regurgitation, which is leaking in the mitral valve. The symptoms of mitral regurgitation or leaking of the mitral valve typically are shortness of breath, swelling in the legs, or symptoms of heart failure in general. If the cardiologist or the physician identify mitral regurgitation or leaking mitral valve as a problem, then we typically ask our surgeon to evaluate if the patient is a good candidate for surgery or not, open heart surgery. If they're not, or if they are high risk for open heart surgery, then we offer the MitraClip. MitraClip is a procedure that, once again, we do through the groin. It's through a needle. It's a procedure, it's not surgery. And we basically, what we do is we go from the groin up to the heart, and we go to the mitral valve, and we basically clip or approximate the leaflets of the valve to reduce the leak. And that way, it will improve the amount of leaking of blood in that valve. And hopefully that translates into improvement in symptoms.
There's a lot of good things happening in the Heart and Vascular Institute. If you have any questions on the topics that we discussed this evening, please give us a call at 740-454-0804. Thank you.
Thank you. That was great information. Next, we have a demonstration by the Genesis Heart and Vascular team, Brooke Smith and Chelsea Tusing. They're going to show us a few exercises we can do from home to be heart strong.
Hello, I am Brooke Smith.
And I'm Chelsea Tusing.
We are with the Genesis Heart and Vascular Rehab team. One way to keep your heart strong is a medically supervised program that helps improve cardiovascular health through a combination of exercise and education. After a heart procedure, you want to regain your strength and get back to enjoying your life as soon as possible. That's where Heart and Vascular Rehab comes in. If you have had a heart attack, coronary bypass surgery, valve repair or replacement, stable angina, stable heart failure, or a balloon angioplasty, with or without stenting, we will design an individualized program for you. As a team, we all work together to help restore your mind, body, and spirit. You can start the rehab program soon after you are discharged from the hospital. To help decrease readmission for a heart event, most patients can be seen within 7 to 14 days post-discharge. Heart and Vascular Rehab is a 12-week program that runs 3 days a week. Before beginning our program, your insurance will be verified for coverage, and you will be notified before your first visit of your coverage and if you have a copay.
Before beginning the program, you're evaluated by an exercise physiology therapist during an orientation appointment. A program is designed based on your individual needs and goals and revised as you progress. The next step in the exercise program is designed to increase your strength, endurance, and range of motion. During this phase, you'll be hooked up to our heart monitor so we can monitor your rhythm and your rate throughout your appointment. We will also take your blood pressure and check for signs and symptoms of further cardiac complications. Once you begin rehab, you can expect to build up to 45 minutes of continuous exercise. But we will evaluate and create an individualized program based on each patient's needs and goals. During your session, you may complete sets on the treadmill or stationary bikes depending on your limitations. We will plan your program around 3 pieces of equipment and increase your duration and intensity as you progress.
Some interesting and fun facts about Heart and Vascular Rehab are that patients that attend Heart and Vascular Rehab are 53% less likely to die from a cardiac event. Not only does Heart and Vascular Rehab enhance your ability to perform your daily activities, it also helps with fatigue, angina, and dyspnea. If you don't qualify for Heart and Vascular Rehab, you can join our Genesis Risk Intervention Program. This is also known as GRIP. This is a self-paid exercise program in our gym. We offer 16 sessions for $60, to use at your own convenience. With that being said, some examples of exercises you can do at home other than walking or biking are squats, curls, lateral and frontal raises, side bends, calf raises, or wall sits.
When starting any type of exercise regimen, you should first consult your doctor. It is also important to listen to your body and don't overwork yourself. We typically use an RPE scale, which rates your perceived exertion or how hard you're working, on a scale from 1 to 10. When exercising in heart and vascular rehab, we want our patients working at a rate of 3 to 6 on that RPE scale. You should exercise most days of the week for a total of 150 minutes at moderate to vigorous intensity. First, we'll demonstrate how to do calf raises, which is an easy exercise you can do at home. They're low impact. If you're not very stable on your feet, you can grab a chair or use a wall. Brooke will show you how to do a calf raise. You just go up on your toes and then come back down on your feet. The next exercise Brooke will demonstrate will be curls. The muscle used for curls is your bicep, which is used in everyday life. For example, anything that you pick up off of a table you would use your biceps. So doing curls helps enhance your everyday life. The next exercise we'll demonstrate will be lateral and frontal raises, which target your shoulders, which helps increase your upper body strength.
The next exercise Chelsea's going to perform are called squats. This can help with your quads and overall leg muscles. This will help with walking and your everyday activities. You want to make sure that you get your body within a 90-degree angle, and it can be changed by using just your body weight, or you could add weight as well. Side bends are a great exercise for balance, and it also improves your spine flexibility.
We also have a variety of healthy lifestyle programs open to members of the community. Patients and anyone interested in becoming more physically active call Genesis Heart and Vascular Rehab at 740-454-4336 to learn more about exercise programs and class schedules.
Thank you to all our presenters for giving us great information about staying heart strong. Please add your name in the comments to be entered into a chance to win a door prize, and we will notify the winners via Facebook Messenger. We'll take your name for 5 minutes after the live program ends. And thank you for joining us. Be sure to watch for more Spirit of Women programs this year.